नमस्कार दोस्तों, मैं डॉक्टर अनिल कुमार, फाउंडर एंड प्रेसिडेंट हेल्थ केयर स्किल्स फाउंडेशन। जैसा कि हम सब जानते हैं, सेप्सिस एक ऐसी बीमारी है, ऐसा एक सिम्टम है जिसको डे टू डे प्रैक्टिस में वी आर एक्सपीरियंसिंग सिम्टम्स ऑफ सेप्सिस as a critical care specialist, as a physician, as a pulmonologist. All specialty deals with sepsis in some or the other form. Sepsis एक ऐसी बीमारी है या ऐसी एक definition है जिसकी वजह से the healthcare world is suffering and there are a lot of associated morbidity and mortality associated with timely management or untimely management of sepsis or inappropriate management of sepsis. इन सब चीज़ों को देखते ही एक World Sepsis Global Alliance है जिसने एवरी ईयर सेप्सिस अवेयरनेस के लिए वर्ल्ड सेप्सिस डे का आयोजन किया है। एंड इस साल का जो थीम है, इंटरेस्टिंग 5 फैक्ट्स एंड 5 थिंग्स टू डू अबाउट सेप्सिस प्रिवेंशन एंड सेप्सिस अवेयरनेस। अगर हम बात करते हैं सेप्सिस, तो सेप्सिस इज any form of infection, any form of inflammatory response, but as per the definition of sepsis 3 definition, it is the dysregulated response of host to any infection or any insult. देखा जाए तो अगर हम वर्ल्ड सेप्सिस डे 2025 की बात करें, the theme is 5 important facts and 5 things to do that can increase the awareness and improves the outcome of sepsis. अगर हम 5 things की बात करते हैं, तो what it has been mentioned is sepsis is a medical emergency. It can start from a small cut, cough or infection. High fever or very low temperature can be a warning sign. Confusion, fast breathing or low urine output are the early danger signs of sepsis. Early hospital treatment is the essential goal which can actually save lives and improves the outcomes of sepsis. So these are the 5 simple facts about sepsis as per the 2025 awareness about the sepsis day. So अगर हम बात करते हैं 5 actions to prevent sepsis or improve the outcome of sepsis that per the 2025 World Sepsis definition or the awareness drive, we have 5 facts and 5 things. So 5 actions what one can do is, one is very integral, is wash your hands often, because hand washing has been associated with significant or one of the most essential exercise which can actually improve or do a lot of help in prevention of sepsis in healthcare industry. Keep your wounds clean and covered. Get recommended vaccine as per the age, as per the condition, as per the immunocompromised status. Seek medical help quickly if you think there is any worsening of your infection or worsening of your clinical condition or worsening of infection or fever. Ask in clinical world, is this could be sepsis? To catch hold of sepsis early, because prevention and treatment early saves a lot of life. So these are 5 actions which can actually change the outcome of sepsis. So in this year 2025 on World Sepsis Day, I emphasize on 5 facts and 5 actions to improve sepsis awareness and across the healthcare workers. And believe me, these 5 actions what we have just discussed are integral components of decreasing the hospital-acquired infections, increasing the incidence or decreasing the incidence of morbidity and mortality associated with sepsis. And suspecting sepsis is far more important. Early treatment is very important, following the 1-hour bundle, following the sepsis definition, and doing everything simultaneously in first hour of resuscitation holds a lot much importance to prevent and curtail the burden of sepsis.